Tonight, we've learned the number of patients at the Rhode Island Convention Center Field Hospital doubled just in the last 24 hours.
National and local health officials are sounding the alarm, saying people need to do everything they can to flatten the curve. You can see in this WPRI.com graph just how steep the increase in hospitalizations has been over the last month and a half. Doctors warn it could get worse before it gets better. 12 News reporter Kim Kalunian spoke with two doctors managing one of the state's field hospitals and joins us now live in studio with their message. Kim?
Well, Dr. Selim Suner is the medical director of Lifespan's alternative hospital site at the Rhode Island Convention Center, and he told us today having a field hospital like this one is unlike anything he's seen before, and he said it feels like a dream or perhaps a nightmare.
CDC Director Dr. Robert Redfield with a dire message.
But the reality is December and January and February are going to be rough times. I actually believe they're going to be the most difficult time in the public health history of this nation, largely because of the stress that it's going to put on our healthcare system.
Today, we anticipate having about 22 patients by the end of the day.
On 12 News Now at 4, Lifespan's Dr. Kathy Duquette telling us live that the number of patients at the Rhode Island Convention Center Field Hospital had doubled in just 24 hours.
We need to stop this curve of the steep incline of demand for hospitalizations.
Dr. Selim Suner expressed his concerns about the coming days and weeks in the wake of Thanksgiving.
I'm very concerned. What we did 2 weeks ago, we're going to pay for it in the days to come.
A message echoed by Dr. Ashish Jha at Wednesday's State House meeting of the COVID-19 vaccine task force.
I think we should be in for a pretty tough 6 to 8 weeks ahead. So what does that mean? Really, through mid-January, we're going to see our hospitals stretched. We're going to see, unfortunately, a lot of Rhode Islanders get very sick and die of this disease. And we've got to do absolutely everything in our power to keep those infections as low as possible.
And Dr. Suner says they're also trending towards a potential shortage of ICU beds, but so far he says they have not changed their standards of care and are not turning people away. He says that might change in the future, but as of now, patients may stay in the ER for longer or get sent to one of those field hospitals. Live in the studio, I'm Kim Kalunian, 12 News.